I found today very interesting, and there's obviously a lot of variability within how COPD is managed across the UK, and there perhaps needs to be a more standardised and joined up approach on how we tackle this disease and help to empower patients and keep them at home with the cost constraints that we have within the NHS. Within Philips we also have remote monitoring within our ventilators, which helps to assist clinicians to remotely monitor patients. This helps with monitoring patients remotely, but also perhaps predicting when they may be exacerbating and intervening earlier. So there's a common misconception that actually the elderly population do not adopt telemonitoring or telehealth, but a recent study by Philips showed that 26% of patients over 55 were open to adopting connected care technology. Patients with COPD with severe disease, there's a recent study, the HOT-HMV study, which was a multi-centre study which looked at home oxygen versus home oxygen with home mechanical ventilation. And the patients that were assigned to this study had persistent hypercapnia and hypoxemia. Following the trial, they were able to show that there was a 3-month improvement in readmission rates within this patient group. So evidence is growing within home mechanical ventilation to show its effectiveness in supporting patients with COPD and keeping them at home.